The health issue of our group is sexual and reproductive health. We choose human immunodeficiency virus, which is termed HIV, as our topic. According to Department of Health, there are 6,646 HIV patients in Hong Kong, and around 99% of them are not from perinatal. WHO also mentioned there are 35 million HIV patients in the world, which include 3.2 million. Nearly 10% clients are under the age of 15 years old. This is important for us to have a focus on this topic. So,
water and a drink.
Leave me alone, please.
What happened? You look so bad.
Nobody who cares about me. Everyone just passed by without paying a single attention to me. I'm a helmet. Why there is anybody to cares about my needs? Can I go back to the previous Korean war? I want to go back.
I have you to find. What's wrong?
A patient come back to our pediatric ward again. They complained that the doctor and the nurse ignored him and didn't pay attention to them. She felt pressure in that ward. It is the first case in our ward. It is annoying to me.
Don't you perform transition care to your patients?
Transition care? What's that?
Have you never heard of it? I know a nurse who is an expert in it. Let me see if she is available. She said we can go and meet her now.
Oh, that's great. What are you waiting for? Let's go.
Okay. Come in.
Good morning.
Please take a seat.
The trainer told me that you wanted to know what is transition care, right?
Yes, actually, I want to know how to perform the transition care for the HIV patient. Can you teach me?
Sure, no problem. We have just made a protocol for that. Okay, let me find it first. Well, there are 3 stages in transition care, and they are early stage, middle stage, and late stage. It begins from the patient's admission to pediatric ward until they transfer to the adult ward.
What is the detail of it?
Good question. There are 6 areas in transition stage. This includes self-advocacy, health and lifestyle, sexual health, educational and vocational planning, independent healthcare behavior, and psychosocial support.
Oh, I see.
Let's talk about self-efficacy, health and lifestyle first. For the self-efficacy, there are 2 goals in the early stage. The first one is to understand the disease of HIV and clarify the misconception. What we could do is to deliver the information of HIV disease, such as the treatment alternatives. Identify the misconceptions of clients by continually assess his or her level of understanding. Clarify the misconception by asking questions about the disease. The second one is to understand the patient's rights and responsibilities. We could encourage clients and parents to speak out their concerns and difficulties encountered, and give corresponding support by regular case conference. Encourage his or her parents to participate in the meeting, since parental support is essential for clients to conduct a progressive treatment. Remind clients to bring medical identity card. In the middle stage, we urge to focus on the development of self-awareness of HIV by introducing the reliable information platform for searching information of HIV. Also, nurse to provide information about HIV services among the non-profit organization, so as to help them to seek help from those organizations if necessary. We could also focus on the development of ability of critical thinking on decision making. Nurse lists out the possible treatments and assist the clients to choose by introducing the advantages advantages and disadvantages of the options, and to discuss the risks and benefits of treatment with clients and emphasize his or her autonomy to choose the suitable one regarding his or her situation. In the last goal, we could also pay attention to the development of responsibility on prevention of transmission to the others through introducing the risks of HIV transmission and preventive methods, and introducing the client himself or herself as an HIV carrier before performing invasive procedures. For the late stage, the goal is to understand the restrictions and make decisions on further transition care. Our nursing actions should include the introduction of the information of different adult HIV care units for clients to make decisions, assisting the clients to analyze the information and explore the related restrictions by comparison, and helping clients to arrange a new clinic visiting after selection. Let's move on to the health and lifestyle session. There are 4 goals in the early stage. Firstly is to understand the importance of the healthy lifestyle. Therefore, we can refer clients to the dietitian to discuss the calories and nutrition needs, provide an easy-to-follow food and nutritional tips on a specific topic in an easy-to-understand, convenient, or printable format, provide information on the disadvantages of alcohol and smoking, and avoid clients to quit smoking and limit the alcohol taking. Encourage clients to explore the health issues they concerned via sharing session. And the last action is to encourage clients to do regular exercise, at least 30 minutes per day. Secondly, the goal is to understand the nutritional needs based on the present physical conditions. What we could do is to provide information about healthy diet and provide some healthy cooking methods to the parents. Thirdly is to find out problems or barriers of the health and lifestyle. Hence, we ought to assess the nutritional state, eating habit, and activity of daily living of the clients. To identify any potential problems, it is better for us to provide an open and supportive environment to help clients explore their health problem. Fourthly is to develop a cooperative relationship between clients and parents in the care program. Therefore, encourage parents to take part and act as an intermediary between parents and clients to maintain a good cooperating relationship. For the middle stage and late stage is to develop and encourage autonomy in management of healthy lifestyle. What we should do is to assist clients to design daily schedule and activity arrangement. Arrange supporting groups to motivate clients to participate in managing health and help them to develop hobbies. The second one, to have a clear concept of health and can maintain healthy lifestyle independently. It is better for us to reinforce clients to obtain more knowledge of lifestyle modification to achieve health. Encourage and educate the parents or caregivers. Give chance to the client to take control of his or her healthy lifestyle. The last one is to develop the confidence and responsibility for self-care in future. And the related action is to promote opportunity for the client to make decisions and give feedback for his or her performance.
Why are there only 2 stages?
Once they have understood and acquired the knowledge and skills, it's not necessary to have 3 stages in each area. Any other problems? If not, let's move on. For the sexual health part, there are 3 goals in the early stage. The first goal is to understand the physical changes associated with puberty. We could provide a brief concept to clients for organizing a discussion about the body change of the secondary sexual characteristics. The second goal is to understand the information and importance about sexual health. We ought to explain the importance of safe sex in order to prevent further spread of HIV. Identify and explain the differences between various contraceptive methods. Demonstrate and ask for return demonstration on proper use of condom with a model of human body. Nurse can also educate clients about the rules of sexual transmission disease. We can also deliver the additional information of the STDs such as the pathophysiology, manifestation, and complications. Moreover, we can also provide information about reliable sources such as the public clinic, Department of Health, DH, AIDS concern, etc. The third goal is to understand the importance of early HIV detection of client's partner. The nursing action should include the concept and importance of early HIV screening to the client and advise clients to invite his or her sexual partners to receive the diagnostic HIV tests. For the middle stage, to maintain a positive attitude about attaining sexual health. As a nurse, we could assess the difficulties encountered by regular case conference. Refer clients to the psychologist if discovered any abnormal emotional problems, and provide useful online resource for clients to help solving the dilemma among the partners. The second one is to understand how to maintain a healthy and safety relationship with partner. The main action is to advise clients to diminish the number of sex partners and maintain regular sex partner to lower the rate of further spread of HIV. For the late stage, the main goal is to develop confidence and responsibility for further family planning. What we can do is to explore his or her opinions and discuss the family plan by regular case conference. The last action is to provide information about offspring planning if necessary.
I got it. Let's take educational and vocational planning as.
Okay, is it just like that? There are 3 stages in the educational and vocational planning. In the early stage, there are 3 goals. The first one is to develop a sense of obligation and rights at home. The things we should do is to assess the concept and understanding of clients about the obligation and rights at home. Furthermore, we should determine about the sense of belonging at home. The other goal is to maintain a positive attitude towards the present situation and the future. Inside this, we should determine the difficulties and stress encountered to clients in the school, and consider their goals and expectations on the academic issues. After that, we also need to assess the level of self-esteem and the sign and symptom of the potential mood disorder or other mental problem. The third one is to maintain a good relationship with friends, family, and the medical staff. The first thing we should do is to assess the relationship between the clients and those person. After that, we need to arrange experience sharing sessions among the clients with HIV about the study issue. The last thing we should do is to encourage them to seek professional help when encountering difficulties or problems among emotional issue or physical issue. Then we move on in the middle stage. There are also 3 goals in it. First one is let them to understand the academic and career in the future. We can help the client to explore the plan for continuous study or job seeking and expectation. Also, the potential difficulties encountered in the future career path. The second goal is to help them to have a well support on job seeking. We need to arrange the experience sharing session among the clients with HIV to express and share their opinion on working, and encourage them to set the career goal in the career path and solve the problem difficulties in the career counseling. In the late stage, there is only one goal, is that the patient should feel confidence on the future academic and career plan. The action of it is to assess and arrange case conference for the arrangement of medical follow-up and study schedule in the university or working time in the company. Then we should determine the barriers existed on job seeking or in the new academic environment of them. The other thing we should assess the client is the mood and feeling change among the trained ward and on the academic or career issue.
Yes, you're right. Nifina, can you tell us more about independent healthcare behavior and psychosocial support?
Okay, let me see.
For the independent healthcare behavior, there are 2 goals in the early stage. The first goal is to understand the information and importance of medical therapy. We could provide information of highly active antiretroviral therapy drug use in Hong Kong, explain the effects and side effects of medications clearly to the client, educate the client about the importance on continuing medication, educate the client about the impact of missing dose, and to explain the potential barriers of the therapy. The second goal is to understand the importance of keeping personal hygiene in order to prevent HIV transmission. information. We could educate the client the roots of HIV transmission and the related preventive methods, and deliver information to the client to prevent opportunistic infections. There are two goals in the middle and late stages. The first goal is to understand that help should be sought from different departments for different situations. We could introduce possible emergency situations and related care, such as emergency care of trauma, and provide information to the client on different medical services and departments such as the Hong Kong Government AIDS Office. The second goal is to become self-independent on taking medication and attending regular follow-up appointments. We could encourage the client to take part in the healthcare behavior without parents' assistance. Deliver healthcare behavior information in the meeting. Encourage the client to attend medical follow-up regularly, and to assist the client to write a personal health record book to remind him or her for the medical follow-up. For psychosocial support, there are three goals in the early stage. The first goal is to identify the risks of emotional problems of the client and the family. We could assess if there are any risks of the potential emotional problems of the client and the family, such as stress or depression. Provide the corresponding psychological support to client and family members. For example, introduce them to the New Life Psychiatric Rehabilitation Association, and to encourage the client and family to express their feelings in order to relieve their stress and depression. The second goal is to identify any financial problems among the family. We could assess if there are any financial difficulties among the family members. Refer the client to medical social worker to provide financial support if needed. Deliver useful information from different organizations such as the Social Welfare Department to help and relieve the financial problem, and to provide temporary financial assistance to needy HIV or AIDS clients and their families in Hong Kong by the Social Welfare Department. The third goal is to develop the psychological acceptance of the client and the family. We could encourage the client to join a peer group or a social support group for case sharing and to obtain community resource. Encourage the client and his or her family members to participate in the center program organized by the Society for AIDS Care to strengthen the self-esteem and broaden the social circle. Collaborate with the medical social worker for psychological support and help the client and caregivers to have a way to release the pressure if necessary. And to help the client to accept the disease by regular psychological counseling as needed. There are four goals in the middle and late stages. The first goal is to develop a good social network of patients. We could encourage the client to join group activities to expand the social network. The second goal is to perform and maintain good social hygiene. We could educate the client how to maintain a good social hygiene among the social activities, and educate him or her the transmission route of HIV in social activities. The third goal is to encourage the client to face the disease of HIV in a positive way. We could organize regular case conferences to encourage clients to express emotional feeling, and provide regular counseling for clients in order to help him or her to adapt to the normal social lifestyle and activities. The fourth goal is to maintain a good psychological status on facing HIV in the future. We could reinforce and remind the client how to maintain a good psychosocial status.
Thank you, Lavina. You're right. Actually, don't forget to include the evidence session after performing those nursing actions. To know more information, please refer to our protocol file.
Hey, you look great.
Yes, the people here are so nice and great. I like them very much. And now I feel hopeful every day here.